Acipigrel Uses. Acipigrel is a platelet aggregation inhibitor medication containing Clopidogrel as Clopidogrel bisulphate 75 mg. It is prescribed to prevent blood clots from forming in people with cardiovascular disease. Understanding how it works, following the doctor's instructions, and taking the right dosage. 1 Active ingredient and mechanism of action. Clopidogrel is a prodrug and only becomes active when metabolized by the CYP450 enzyme, inhibiting platelet aggregation. Mechanism of action. Platelet aggregation is a crucial step in the formation of blood clots. Clopidogrel inhibits platelet aggregation by blocking the ADP adenosine diphosphate receptor on platelets. When Clopidogrel is metabolized into its active form, it irreversibly binds to the ADP receptor on the platelet surface. Mechanism of action. This binding inhibits platelet activation caused by ADP, preventing platelet aggregation and thrombus formation. Result: platelets exposed to Clopidogrel are inhibited from binding for their lifetime because the drug's binding to the ADP receptor is irreversible. This helps reduce the risk of blood clots, particularly in individuals with cardiovascular diseases. 2 Uses of Acipigrel. Acipigrel is prescribed in the following cases. Preventing blood clot formation. In patients who have had a heart attack, stroke, or peripheral artery disease. In patients who are being treated with stents to open blocked coronary arteries. 2 Uses of Acipigrel in patients who have had a heart attack, stroke, or peripheral artery disease. In patients who are being treated with stents to open blocked coronary arteries. 2 Uses of Acipigrel stabilizing patients with unstable angina or non-segment elevation myocardial infarction. Acipigrel is used in combination with aspirin to treat patients with unstable angina or non-segment elevation myocardial infarction. 2 Uses of Acipigrel preventing stroke in high-risk individuals. Acipigrel can be used to prevent stroke in high-risk individuals, such as those with atrial fibrillation or a history of stroke. In patients who have had a heart attack, stroke, or peripheral artery disease. 2 Uses of Acipigrel in patients who are being treated with stents to open blocked coronary arteries. 3 Precautions when using Acipigrel. Do not self-medicate. Acipigrel should be taken only as directed by a doctor and monitored closely. Do not take this medication without a doctor's guidance. 3 Precautions when using Acipigrel. Dosage and treatment duration. The doctor will determine the dosage and treatment duration based on the patient's condition and health. Always follow the prescribed dosage and treatment duration. 3 Precautions when using Acipigrel. Side effects. Acipigrel can cause side effects such as bleeding, gastrointestinal bleeding, headache, dizziness, and nausea. Inform your doctor immediately if you experience any side effects. 3 Precautions when using Acipigrel. Drug interactions. Acipigrel can interact with other medications. Tell your doctor about all medications you are taking, including prescription medications, over-the-counter medications, vitamins, and dietary supplements. 3 Precautions when using Acipigrel. Caution for pregnant and breastfeeding women. Acipigrel is not recommended for pregnant and breastfeeding women. Driving and operating machinery. Acipigrel can cause drowsiness and dizziness. Therefore, exercise caution while driving or operating machinery. 3 Precautions when using Acipigrel. Note: the information in this article is for reference only and should not be considered as medical advice. Consult a doctor before taking any medication.